So did he talk about hematological and stuff like that, or
A little bit.
a little bit?
Yeah. I'm trying to think. The one he stressed, yeah. Just like they had poor diet and high folic acid.
Oh, yeah, okay. So why does someone become anemic when they have cirrhosis? Is that what he's talking about? Like, because they're not eating,
Yeah.
they're not having an appetite, and because the varices can bleed and they can lose blood that way. And does everyone know, like, what it's called when I have an upper GI bleed and I'm pooping and there's blood?
Curry stools?
Melina. Remember that name from first semester forever ago? Yeah, what were we talking about?
Melina.
Melina. And then what is it called when I have a lower and it's red?
A cold?
A cold stool. Yep. Does everyone understand what the word epistaxis means?
Nosebleed.
Nosebleed, bloody nose. And this is all just because of the clotting factors again. Like they get the gingival bleeding and the bruising, the petechiae, all because of the clotting factors. So, if someone has cirrhosis, what would we want to teach them about at home with their ADLs?
Use a soft toothbrush.
Yeah.
Don't do anything risky.
Use an electric shaver, not a razor. Don't take aspirin. Stuff like that, okay? And then the gynecomastia, the amenorrhea, that all should make sense because we just got done with endocrine and we dealt with the same problem there. They have just too much estrogen. So the men get boobs, the women stop having periods and stuff like that.
But you have the vaginal bleeding from the lack of clotting factors or
Yeah.
from the, what's it called? Hypertension or
Yes. And just remember that, please. Like, aldosterone's not metabolized, so they're going to be retaining water because of that, too. And so we might be dealing with a potassium issue. We might have to give potassium supplementation for someone with cirrhosis.
because they're peeing the potassium out.
They're peeing they're holding on, they're holding on to the water and sodium. And anytime my body tries to hold on to sodium, it usually kicks out potassium, or vice versa. If I'm holding on to potassium, I kick out
Do
sodium.
they have low aldosterone or high aldosterone?
High, because it's not getting metabolized in the liver. If the liver is now, like, not working. I mean, this is kind of easy. Like, all these things we're talking about are late manifestations. The only early ones are all those flu-like things. So it'll be easy for you guys to remember, like, what's late and what's early. So we already talked about ascites and the edema because of the low albumin. And then you could percuss it and see the waves. So that would be a good assessment. And that's how you would tell. She told us between adipose and ascites are like abdominal distension and stuff. Okay. Does everyone understand the whole collateral vessel thing with my liver? Wow, I slivered. So, who understands the collateral vessels? Hypertension.
This is related to ascites.
It's related to a sign and symptom. They get, if you lift up someone's shirt and look at their ascites, they have like all these veins that you can see around here. So when I have portal hypertension, it backs up into other veins, and that's how I get like esophageal varices and stuff. Also, it tries to find other routes around the liver. So it doesn't go through the liver, it goes like above or like around it. And so that's why on with cirrhosis, you might see like purple veins and stuff like that on their
like the
abdominal
veins are
wall.
big.
They're like bigger and showing up easier. And that would be called collateral veins, collateral vessels. So you will want to know about a liver biopsy and kind of like the post-op care. Your Swearingen's book, I think, is where I went, and I found a lot of good information there.
Sorry, what was it we looked up?
The liver biopsy.
Okay.
I went to the Swearingen's, and I think that's where I got like a lot of good information. How am I going to prepare the patient for a liver biopsy? Because it's invasive.
It's gonna be painful.
Yeah.
I don't know.
So we're probably gonna give a local anesthetic. He's probably gonna numb it with like lidocaine or something around there. And we're gonna teach them medications to avoid before. So like, are you taking any anticoagulants? Are you taking anything that could be toxic to the liver, like an antibiotic or Tylenol or something like that? We're gonna avoid those. But the most important thing is just knowing that the liver is super, has a lot of blood flow to it.
It's very vascular.
Yes, that was the word I was looking for. So I'm gonna have them lay on what side? The right side. And I'm gonna put something underneath where I went in, and it's gonna be like a sandbag or an IV bag or something like that to put pressure on it. When someone does get a liver biopsy, they're usually on their back, like with their arm up, because that kind of moves the liver over onto that right side where the doctor can get to it easier. So, but the liver biopsy is very diagnostic. It can tell us like how bad is their cirrhosis, how bad's the scarring, the inflammation.
Is this like the gold standard test or like the best test
The
to
best
see what's wrong?
to see how far progressed they are. Yeah, because it can show the level of inflammation and stuff like that.